Hello again. So now we will be talking about the anatomy of a chest x-ray. So here we have a chest x-ray. Okay, now let's speak about the lung anatomy at first. Here you have, this is the left lung and this is the right lung. Now the left lung is composed of two lobes. This is the upper lobe and this is the lower lobe. And you can see the fissure right here, the oblique fissure, crossing and separating both lobes. This is crucial in indicating lobar collapse. So if you have upper lobe collapse, then it will happen at this area. If you have lower lobe collapse, it will be right here at this area. Same goes to the right lung. It's composed of three lobes: upper lobe, middle lobe, and lower lobe. And you have two distinct fissures here. You have the transverse fissure or the horizontal fissure that separates the upper and the middle, and then you have the lower oblique fissure that separates the middle and the lower lobe. So this is the lung. Second of all, we have the mediastinal area. The mediastinum is composed of this is the area actually within, situated between the right and left lung. It's composed of the heart. Now looking at the heart, actually from a chest radiograph, you can know quite good information about the heart. So this is the left ventricle. Now look at the shape of the heart, yeah? The left ventricle takes an oblique manner and sits on the diaphragm. The heart is shown as a white shadow. The only way you know it's the heart is actually by its density. It's higher than the density of the lung. So this area here is the left ventricle, since this is the left side, and then we have right down here, it should be the right ventricle. And then you have the left atrium up here, and then you have the right atrium up here, right here. So atrium, ventricle, and then you have left ventricle and left atrium. That's about the heart. Then you have the vascularity of the heart. Of course, we know from the orientation of the heart, the vascularity is right here. So let's go back to our chest radiograph, since that one is labeled. We can see right here, this is again the left ventricle, this is the left atrium right here, then you have here, this is the right ventricle down here, and this is the right atrium right here. Then you have the vascularity. Again, into the right atrium right here comes in this dense line. You can see it right here. This dense line is the superior vena cava, the SVC. Yeah, right here. Yeah, and then you have the aortic arch. This is a very distinct region. It shows as a white area, high in density, and it's called the aortic knuckle or the aortic arch or the aortic knob. This is the area right here. Then it arches like this to form the arch of the aorta. Then you have the descending aorta right here. You can see the line coming down here. It's a very dense line. This is actually the descending aorta. It goes all the way down to the abdomen. Okay, this is the vascularity of the heart. Then we look at a very special area here. Now, we said the low density areas are black. What do we have black here? We have the lungs and we have the trachea. Look at the trachea right here. It's centered. It's nicely oriented between the both apices of the lung. Then we call it the carina, or the tracheal bifurcation. Now look, it happens right here. You can see here it divides into the right main bronchus, and then right here you can see a faint line also. This is the left main bronchus. So at the carinal bifurcation, it's a very important landmark, which is the same as the level of the main pulmonary trunk. You see here this hyperdense area. This is actually the main pulmonary trunk that divides later into the main pulmonary arteries. the left and right pulmonary arteries, sorry. Then you have, what else? This is now the bony region we talked about. I'm not sure if we talked about it, but this is the ribs. We see the first rib right here. It's like a C shape. It's very special. It's a special rib. And then this is the area that forms the thoracic inlet. Right here, you can see. This is the first rib. This area right here is the thoracic inlet, or the entrance of the thorax. Then you start counting. Now, to know whether the patient has taken sufficient inspiration or not is through counting the ribs. Now, this is the first rib. This is the second rib. It articulates right here. Then you have the third rib, the fourth rib, the fifth rib, 6, 7, 8, 9, and part of 10. So adequate inspiration is indicated by seeing 9 to 10 posterior ribs. Now the ribs we just counted are the posterior ribs. Look at how they elongate, and at some point they take a transverse direction. These are the posterior ribs, and then you have the anterior ribs. This is the shadow right here. Look at them. This is the first rib, the second rib, sorry. This is the posterior aspect, and as it goes to the lateral wall, it diverts to become the anterior rib. So sufficient inspiration again is indicated by 9 to 10 posterior ribs or 7 to 8 anterior ribs. Okay, so these are the ribs. Then you have the clavicle, the collarbone, right here. It goes in a transverse way to articulate right here with the area of the scapula, the acromion, to form the acromioclavicular joint, the space right here. It's not shown here. And then this is the scapula. Now the evaluation criteria also suggests that, actually suggests that the scapula has to be away from the lung field. You don't want it to be in. That's why the patient position should be proper. So this is pretty much most of the anatomy. Coming back here again. So this is manubrium, sorry. This is part of the sternum. This is the upper portion of the sternum, the manubrium sterni, or the manubrium of the sternum, the shadow right here. You have the SVC, the superior vena cava, coming out from the right atrium. You have the right main bronchus, as I said here, this is the trachea, and right down here, the carina, this V shape, the inverted V, is the carina. It divides the bronchus into the right main bronchus and left main bronchus. You have fissure, right atrium, again the oblique fissure of the right lung. The IVC is right here. It's not really clear, but you need to know that the place of the inferior vena cava is right here. It comes all the way from the abdomen. Then you have the diaphragm. This is very important. The diaphragm has to be included, and you have the right costophrenic angle. The reason why it's called costophrenic, the phrenic means diaphragm, pertaining to the diaphragm, and costo is pertaining to the rib, or the costal region right here. So you have the right costophrenic angle and the left costophrenic angle. These should not be cut out of a chest radiograph. If they are cut, then the chest radiograph has to be repeated. This is the stomach bubble or the gastric bubble. Now, how to know that this chest radiograph is an erect or a standing position is that the gas in the stomach will rise up due to the gravitational force. So you will see the stomach bubble right here. This is the upper abdomen, so the liver is situated in the right side right here. You can see some artifacts. Artifact is an undesired object that is external to the body. It can be external, it can be internal, but it's something that has been introduced to the body, and it's not, and it shouldn't be there. You have a button here. You can see it. You can see the density. It's probably a gown, hospital gown clips, since this is a patient. Okay, that's all about anatomy, I guess. This is not as detailed. There are more details in the anatomy, so hopefully I'll be able to cover them another time.